Recognize the Leader of the Opposition.
Mr. Speaker, Ontario and British Columbia have ordered hundreds of beds for acute care, ICU beds, even stretchers. We understand that the SHA has not made those same steps to date. Mr. Speaker, it's obviously going to be a very big issue as we have a big increase in the number of admitted patients, that we have enough beds for them to be put in. If we don't make these orders now, if we don't have these beds coming already, we'll be competing with other jurisdictions. We're making similar choices, Mr. Speaker. We need to act fast. What is the plan to have enough beds for the influx of new inpatients? Have these beds been ordered? And if not, when will that happen?
Recognize the Premier.
Thank you very much, Mr. Speaker. It's my understanding that it has happened, that beds have been ordered by the Saskatchewan Health Authority, Mr. Speaker, in addition to the ordering of those beds and a number of other supplies that we predict we may need in the days, weeks, and months ahead. Mr. Speaker, the Saskatchewan Health Association is actively starting to reduce some of the elective surgeries and some of the elective procedures that are occurring in our communities in Saskatchewan to start to create that space in our facilities should we need it, should our numbers increase above the number of 7, which is the current number of positive COVID-19 people here in the province, Mr. Speaker. We are expecting that number to increase. We aren't naive about what we are dealing with here, Mr. Speaker, and we are actively planning within the Saskatchewan Health Authority with respect to ordering and sourcing the supplies that we will need, from testing equipment to beds, as well as opening up the maximum amount of capacity that we have in our current facilities.
Recognize the Leader of the Opposition.
Thank you, Mr. Speaker. Healthcare workers are raising concerns about the SHA directive that sets the date for self-isolation of healthcare workers at March 16. Media stories have shared these concerns, pointing out the risk of transmission to vulnerable and immunocompromised patients. We've heard from returning workers who have returned from travel and chosen to self-isolate for their own health and for the health of those around them, and they've been told that they'll be off work, but they'll be off work without pay despite making those choices for health reasons, Mr. Speaker. Can the Premier please explain the rationale behind this decision and reconsider and review that one-size-fits-all approach to returning healthcare workers?
Recognize the Premier.
Mr. Speaker, I'm uncertain about if there's a healthcare worker that is being told that they won't be compensated as they're off work. I think the government would, and the Minister of Health would like to know about that specific incident. With respect to the directive, the Saskatchewan directive on healthcare workers returning that may not have to self-isolate for 14 days but would be self-monitoring. First, that is mirroring a federal policy that is in place. Second, that is not a blanket policy for all healthcare workers, Mr. Speaker. That is a policy for specific services that may only be provided by a very small grouping of healthcare workers, Mr. Speaker. It is not that they just go to work as they normally would, Mr. Speaker. They have to take some extra precautions, if you will, with some of the personal protective equipment that they will be working to ensure they're protecting not only themselves but also protecting the people that they would come in contact throughout the day. So, Mr. Speaker, that is a very, very selective piece that is in there for just a few disciplines that may be required, Mr. Speaker, and it is a policy that Saskatchewan has adopted mirroring the federal policy.
Recognize the Leader of the Opposition.
Thank you, Mr. Speaker. How is the provincial government planning to address the impacts of COVID-19 on correction centres with increased pressures on staffing and on infection risk? Other jurisdictions have chosen to release some inmates early. Is the Premier planning to do the same? If so, how many and when?
Recognize the Premier.
Thank you, Mr. Speaker. With respect to, I think I caught most of the question. With respect to our correctional centres, Mr. Speaker, there's no plans to release inmates or anything of that nature, Mr. Speaker. What there is plans and what is actively in motion is we are treating our correctional centres in very much the same way we're treating our long-term care homes, Mr. Speaker, where we are restricting the access, the visitor access into those centres, restricting it quite significantly, Mr. Speaker, to ensure that we are not having an outbreak in a confined area like a correctional center, Mr. Speaker. As we know, there will be some individuals that also may be high risk in that facility, and we want to protect those individuals in the very same way that we are making every effort to protect our elderly, Mr. Speaker, in our long-term care homes, in our personal care homes, or in our Saskatchewan group homes as well.
Recognize the Leader of the Opposition.
Mr. Speaker, there are certain groups in our population in Saskatchewan that are higher risk during the COVID-19 outbreak. Seniors, people with immune-compromised health troubles, people with diabetes, heart disease, lung disease. There are also people living in poverty, living in more crowded circumstances. To date, we have not yet seen a plan for how resources will be mobilized different for individuals at risk and in communities at risk, in particular rural and remote communities, on-reserve communities, communities with crowded housing. What is this government's plan to get ahead of COVID-19 in the areas that will be most hard hit?
I recognize the Premier.
Mr. Speaker, we continue to focus in these days on population restrictions, if you will. And as I've said, we've made a number of changes there with respect to long-term care homes, with respect to our personal care homes, our correctional centers, Mr. Speaker, our group homes, to limit the access into those facilities, to limit that point of contact, reduced our numbers of gatherings down to 250. We now see, Mr. Speaker, other provinces that are further reducing that down to 50. Mr. Speaker, I'll have myself and others will have a meeting, the Minister of Health, with Dr. Shahab this afternoon, and we'll see what recommendations he brings today. This is a very fluid environment, Mr. Speaker, and there are changes that will be made day by day. Make that assurance, Mr. Speaker, as we continue to work hard to protect the people and the families of this province of Saskatchewan. With respect to some of our northern and remote communities, the Minister of Government Relations, as well as other ministers, have been on the phone with leaders in numerous committees and numerous communities and numerous municipal organizations and leadership organizations in our communities. Minister of Social Services has been in discussions with Red Cross. Mr. Speaker, myself and other ministers have been in discussions with Indigenous leaders from northern communities as well as southern Indigenous communities, Mr. Speaker. We are continuing to work through some of the restrictions that we are doing, Mr. Speaker. As we go through tomorrow with the release of our investment plans, Mr. Speaker, you will see some of the resources that are going to come behind that restriction conversation.
Recognize the Leader of the Opposition.
Mr. Speaker, with schools closed, many parents are being forced to choose between staying home with their kids and going to work. What supports will the government be providing for parents who don't have childcare now because schools are closed, and if and when the same happens with childcare centres and daycares, and including what are the plans to make sure that families where both parents are needed on the front line of healthcare, how are we going to make sure that those families have the childcare support they need to get through this difficult time?
Recognize the Premier.
Mr. Speaker, three good questions in there. The first, Mr. Speaker, with respect to the schools closing, this was a very difficult and challenging decision. One that didn't come about lightly, Mr. Speaker, but one where we felt we really tried to draw the balance between the safety of our children, ultimately the safety of people in our community, but also providing that opportunity for people that need a few days to transition into some childcare options. And Mr. Speaker, they would have that during the course of this week. With respect to childcare options, Mr. Speaker, that is challenging. And there may be resources that will be required, Mr. Speaker, and we will be looking to the federal government and their stimulus package that comes tomorrow and how the province can then dovetail in and support best the families here in this province, Mr. Speaker. With respect to healthcare workers specifically, that is a discussion that is actively ongoing here in the province. The essential services that we will need, and they may not just be in healthcare, they may be the individual that is ensuring the water treatment facility and the wastewater treatment facility in our communities is operating. It may be the individual that ensures that we are able to get back and forth to work, or our law enforcement officials. There are a number of essential services. If we get to that point, Mr. Speaker, that we will ensure that we are working closely with them to support them so that they can continue to do that essential service, continue.
They're limiting gatherings of 50 people or more. We know that very soon we'll likely stop gathering in this room as well. and that's entirely appropriate, Mr. Speaker, for the protection of the public and for the safety of everyone in this room. However, the work that happens in this legislature is extremely important. How does the Premier plan? Should this legislature be closing down, how does he plan to continue that work effectively? How does he plan to involve the members on this side and leaders throughout the public in coming up with the best health and economic response to make sure that on the other side of this pandemic, we look back and see Saskatchewan as one of the success stories, that we got ahead of this, that we flattened the curve, that we did the best we could?
Recognize the Premier.
Thank you very much, Mr. Speaker. With respect to updating the members opposite and updating the general public in the province of Saskatchewan as well, we have our Chief Medical Officer, Dr. Shahab, will be updating the public daily. Mr. Speaker, I believe he will be in just not too long this afternoon, Mr. Speaker, and again tomorrow, the day after that. And I think that's important, not only for us in this House, but for members in our community to be able to listen directly to the Chief Medical Health Officer as to where we are today versus yesterday and where we may be heading tomorrow, along with any recommendations that he may have. Mr. Speaker, we'd also commit, as I know has occurred yesterday, to update the Leader of the Opposition from time to time as well with respect to exactly what our intentions are and how, and take advice, quite frankly, Mr. Speaker, from the Leader of the Opposition and others as to what moves we may have to make in the days ahead, Mr. Speaker, and on an ongoing basis as we deal with this pandemic. Also, Mr. Speaker, with how we are going to support a move from restrictions, not totally away from restrictions, but from restrictions to the resources necessary, Mr. Speaker. You're going to see, as all of the people of this province are going to see, our spending plan tomorrow, Mr. Speaker. Our spending plan, which will be the starting point for how we are going to start to support the people, the families, the jobs of this province, Mr. Speaker. In fact, some of that is going to start even today with the introduction and hopefully the passing of some legislation that is going to protect the jobs of hardworking people in communities right across Saskatchewan.
Ministerial statements. Introduction of bills. Presenting reports by standing and special committees. Why is the Minister of Labour Relations and Workplace Safety on his feet?
Thank you, Mr. Speaker. To request leave to introduce and consider all stages of Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020, immediately.
The Minister has requested leave to introduce Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020, immediately. Is leave granted? Leave has been granted. The Minister may proceed.
Mr. Speaker, I move that Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020, be now introduced and read a first time.
It has been moved by the Minister that Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020, be now introduced and read the first time. Is it the pleasure of the Assembly to adopt the motion? Carried.
First reading of this bill.
The Minister may proceed to move second reading of this bill.
Thank you, Mr. Speaker. I will be moving during my remarks second reading of Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020. First, I want to thank the staff who worked quickly to put together the necessary amendments to the Saskatchewan Employment Act. It is through their hard work and dedication that we have been able to move swiftly. With the onset of coronavirus, we want to ensure that workers do not need to be concerned about their jobs should they need to take sick leave or care for someone who is ill. Today, I'm pleased to say that our government is removing the requirement for an employee to have 13 consecutive weeks with an employer. We are also removing the requirement for illnesses to provide requirement for the employees to provide a certificate of illness or injury from a medical practitioner. These two amendments ensure that all employees can take sick leave and know that they have a job to come back to. New to the legislation is the introduction of an unpaid public health emergency leave that can be accessed when the World Health Organization has determined that there is a public health emergency, and the province's chief medical health officer has also issued an order that the measures be taken to reduce the spread of a disease, or that the province's chief medical health officer has independently issued an order that measures be taken provincially to reduce the spread of a disease where it is believed there is sufficient risk of harm to citizens of the province. The orders would also be made public to ensure everyone is aware of the direction. The provisions in the Act would allow employees to access the new leave to provide care and support to children or family members who are affected by the government's direction or the Chief Medical Health Officer's order. It can also be accessed when an employer directs the employee to go home from work, a physician requires an employee to go home, or the government or Chief Medical Health Officer directs that they go home. Our government believes that these amendments are the right thing to do for Saskatchewan employees so they have the necessary job protection in place, but also so that the health and safety of everyone is their priority. As a province, we have always taken care of one another, and this bill continues that practice in a way that makes sense for Saskatchewan. Mr. Speaker, I want to announce to the Assembly the receipt of royal recommendation for the following bill. This was not received in time to appear on the order paper. Therefore, I beg to inform the Assembly that His Honour the Lieutenant Governor, having been informed of the subject matter of Bill 207, the Saskatchewan Employment Public Health Emergencies Amendment Act, recommends it to the consideration of the Assembly. Mr. Speaker, it's my privilege to move that Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020, be now read a second time.
The Minister has moved second reading of Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020. Is the Assembly ready for the question? The question before the, recognize the member for Saskatoon Centre.
Thank you, Mr. Speaker. Thank you for the opportunity to rise today in this House to enter into the debate on Bill 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020. I first want to thank the Minister for the embargoed briefing earlier so that we can all work together to approve this as quickly as possible. Mr. Speaker, we are indeed in grave circumstances, and we must act as quickly and as effectively as possible as we respond to the global pandemic of COVID-19 to ensure that supports are in place to protect Saskatchewan workers. Mr. Speaker, the time is now to act. Mr. Speaker, we need measures to support workers, low and middle income families, including supports for people who can't access childcare as a result of school closures and those who are at risk because of their own unique circumstances. Mr. Speaker, the opposition supports this measure for public health emergencies leave that is based on the Chief Medical Health Officer's determination that we need to take effective measures to stop the spread of the disease, in this case, COVID-19. We note and support that no medical note is needed. The length of time is based on the call of the Chief Medical Health Officer's order and covers many unique circumstances, including parents whose children who will be at home now because of school closures and people who need or are required to self-isolate. We were hopeful that paid leave would have been possible, but we believe this is a good step forward. People are looking to their leaders and their legislatures to work together to deliver on that. We will keep doing that as we go forward, as we address the many needs that we know will arise, as we are indeed in uncharted territory. Mr. Speaker, as the opposition, we are committed to doing our part. I now conclude my remarks. Thank you.
Question before the Assembly is the motion by the Minister that Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020, be now read a second time. It's a pleasure of the Assembly to adopt the motion. Carried.
Second reading of this bill.
To which committee shall this bill be committed? I recognize the Minister.
Thank you, Mr. Speaker. I designate that Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020, be committed to the Committee of the Whole on Bills, and said bill be considered in Committee of the Whole on Bills immediately.
This bill stands committed to the Committee on the Whole on Bills. I do now leave the chair for the Assembly to go into Committee of the Whole on Bills.
item of business before the committee is Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020. Clause 1, short title. Is that agreed? Carried. Clause 2, is that agreed? Carried. Clause 3, is that agreed? Carried. Clause 4, is that agreed? Carried. Clause 5, is that agreed? Carried. Clause 6, is that agreed? Carried. Clause 7, is that agreed? Carried. Clause 8, coming into force, is that agreed? Carried. Her Majesty, by and with the advice and consent of the Legislative Assembly of Saskatchewan, enacts as follows. Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020. I recognize the Minister.
Move to the committee amendment.
The Minister has moved that the committee report Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020 without amendment. Is that agreed? Carried. I recognize the Minister.
I move that the committee rise, report progress, and ask for leave to sit again.
The Minister has moved that the committee rise, report progress, and ask for leave to sit again. Is that agreed? Carried. I sign it across here.
Recognize the chair of committees.
Mr. Speaker, I'm instructed by the committee to report Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020 without amendment.
The Minister may proceed to move third reading. Recognize the Minister.
Mr. Speaker, I move that Bill number 207, the Saskatchewan Employment Public Health Emergency Amendment Act 2020, be now read and passed a third time.
It has been moved that Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act, adopt the motion. Carried.
Third reading of this bill.
When shall the committee sit again? Recognize the Minister.
Next sitting, Mr. Speaker.
Next sitting. I'm advised that His Honor, the Lieutenant Governor, is here for royal assent. All please rise.
Governor of Saskatchewan.
Pray be seated.
May it please Your Honor, this Legislative Assembly at its present session has passed a bill which, in the name of the Assembly, I present to Your Honor, and to which bill I respectfully request Your Honor's assent.
Your Honor, the bill is as follows. Bill number 207, the Saskatchewan Employment Public Health Emergencies Amendment Act 2020. In Her Majesty's name, I assent to this bill. Members of the Legislative Assembly, a little bit unusual for me to remain, but in conversation with the Speaker, I ask for a moment of your time. It is unprecedented times that we face collectively, and I just wanted to personally acknowledge that fact, but also acknowledge the work that you continue to do and will into the future to make sure that the citizens of Saskatchewan who you represent will receive the appropriate supports as we move forward to face this challenge across this province, but also across this country and around the world. It is a difficult time, particularly for leaders of communities, and in your case, the province, and all of you play an important role to ensure that the citizens of Saskatchewan have the confidence that you are doing what is right for them. I certainly do, and I express that now. I have the confidence that you will continue to do the role that you pledged to, and will support you in any way I can. And finally, as you work to support us or the citizens of Saskatchewan, I want to encourage you and urge you to make sure that you look after yourselves and your families. So with that, again, thank you. Thank you for your ongoing service to the citizens of Saskatchewan.
Why is the Minister on his feet?
Mr. Speaker, I move that this House do now adjourn.
It's been moved that this House be now adjourned. Is it a pleasure assembly to adopt that motion? Carried. This House stands adjourned until 1:30 p.m. tomorrow.